Hi, my name is Paul Ramsey. I'm the Executive Director of A Little Help. We are a Colorado-based nonprofit who helps older adults thrive in their homes through volunteer rides, community-based social events, and other educational opportunities. We really try to help folks navigate into areas of aging that none of us have navigated before on our own. A tough talk is a difficult discussion on kind of tough issues. Like we've had in the past the Chief of Police of Denver come and talk about senior safety and crime issues. We've had end-of-life discussions with panels of various backgrounds, and we've also had conversations about when to give up the keys and things like this. And we have a diverse panel on each of these discussions that really help fill in a subject in a way that most of us haven't had that comprehensive of a look at before. This tough talk that you've tuned in for is sex after 60. And we have partnered for this tough talk with Sage of the Rockies, which is part of the GLBT Center of Denver, and with Boomers Leading Change of the Rose Community Foundation. In this conversation, you're going to hear from a sex therapist, a sex educator, and a medical doctor, and you'll explore a subject that has been considered taboo by some folks in a way that's very informative, entertaining, and sometimes kind of funny. So I hope you'll enjoy the Tough Talk, and I hope that you will learn more about our organization, A Little Help, and our partners who are promoting this event. Thank you very much.
My name is Moshe Rosejahl. I'm a licensed professional counselor here in Denver, Colorado, and I'm also a certified sex therapist. I work with couples and individuals doing the whole range of issues of sex and sexuality, going from any issues around sexual function, expression, sexual orientation, including sexual addiction and sexual trauma. I also work in other areas such as depression, anger, and all areas of men's and women's issues. Thanks.
Hi, my name is Othniel Seiden, Adi for short. I'm a retired physician, started in general practice in about 1964, and was in practice for 44 years. And while I was in practice, I also started writing as an avocation. And in those days, general practitioners did a lot more than family doctors do today. We did minor surgery, we did deliver babies, we took care of entire families, their depressions, their anxieties, their relationships. And that's kind of what got me started in the field of relationships and sexuality. I also started writing mainly as an avocation. Since then I've written 60 plus published books, and about 45 of those are in the medical self-help area.
Hello, my name is Dr. Joyce Lisbon, and I wanted to let you know a little bit about myself. I've been a sex and health educator for many, many years. I've worked at health departments and at universities. Most recently and presently, I am the Executive Director of the Colorado Religious Coalition for Reproductive Choice, and I'm also the founder and developer of a smart sex app for the iPhone. So as you can see, sexual health and relationships have been a very big part of my life, professionally and personally. So we are going to let you be part of seeing a panel discussion that will begin soon, and I hope that it will be very helpful to you and make you more comfortable as a senior to begin and continue to enjoy sex in new relationships.
So some of the questions that I would like us to address today are what is sexuality and how it's socially constructed, who gets to define sex and sexuality, Also, how does the social construction of sexuality impact men and women differentially? What's the role of ageism, especially as we're talking about age and sex? What are the barriers to healthy, mature adult sexuality? And what defines healthy, mature sexuality? What are the myths? What are the facts? What issues are unique to the LGBT community around this issue? And what are the issues that are encountered by aging adults in the managed care system, because many of us will find ourselves in that system? And finally, what are some of the resources that we can connect with in order to make our sexual lives potentiated? So, as you probably know, all of us are sexual. And we are born sexual and we die sexual. Sexuality is never taken, is never separate from who we are. So any construct that impacts that is not something that is inherent to us, it's something that we are influenced by. Sexual health is integral to wellness, to relationships, to overall human activity. As I just mentioned, it occurs throughout the lifespan. So, when, let me just get this other slide. And, we often think of sex as just being limited to genital-oriented activities. And of course, our sex and sexuality is not just about, intercourse, or sexual intercourse or sexual coupling. It is so much more. It is about our life force. It is about our creative force. It is about all the ways in which we relate on physical and affectional levels. It involves biological, psychological, sociological, emotional, and spiritual variables of life. It affects our personal development, our interpersonal relationships. It includes our self-perception, self-esteem, our history, personality, concepts of love and intimacy, and body image. And it is an expression of our affectional and sexual orientation. So I'd like you all to think about, when we think about sex, right, what do we think about? Can I get some responses? Think about sex equals what?
Cleavage.
Cleavage?
On that going around. Way too much going around.
Okay. What else?
Teenagers.
Teenagers.
Intercourse.
Intercourse. Right? So our responses are often constructed by all the messages that we've heard about what sex should be. Now, let's add the component, do these apply to older adults? Does cleavage, does intercourse, right? How has our concept of aging been influenced? How are the messages about aging been influenced our concept of sex and sexuality? And so that brings up the issue of what's called ageism. Ageism is one of the oppressions, right? It is the disempowerment. It is the stereotyping. It is the discrimination against individuals or groups based on age. And that is perpetrated in our culture through subtle and institutional ways that are enacted in policies and also in ways in which rights and privileges are not given to groups or individuals who are older. So how does ageism impact our understanding of sex and sexuality for people who are over 60? So what are some of the stereotypes? What are some of the assumptions that ageism instills in us about how people who are older or mature adults show up in the world as sexual beings? Can anybody give me some of those?
We're not.
What?
We're not considered a sexual being.
Right, not sexual beings. Anything else?
Not attractive.
Not attractive. Anything else? What are the messages? How you think about it is actually how we manifest it up to ourselves and to others.
I think it goes along with being powerful too, that sexuality gives you a certain kind of power that you are not allowed to have when you're older.
That's right. And by definition, any oppression is about disempowerment. And so ageism is about the disempowering of older adults in the ways in which we look at ourselves and look at our agency in the world. So certainly issues of desire, are we desirable, can we manifest desire?
I also think it's a huge taboo that's a generally accepted, almost universally accepted taboo about sex and older adults. When I announced this at our picnic the other day, all the folks, unanimously, all the folks over 80 just said, "Why would you talk about that?" Like it was as if I wanted to talk about any other taboo, generally accepted taboo subject.
Right. So anything that's a taboo subject is really about shame, right? And so part of ageism is actually inculcating all of us that there's something shameful about being older and being sexual. And so that leads us to the next thing, which is that when we experience an oppression, those of us who are part of that marginalized group internalize that oppression. We come to believe in those stereotypes, in those assumptions, in those beliefs. So we become shameful of our own sexual feelings, sexual desires, and so how is that going to be manifested in our lives? So as a therapist, we often think of, older people, right? The assumptions are we don't have desire, we don't have, we have sexual dysfunction and so on. But so what does that do? Do older people show up to therapy for these issues? They tend not to. In other words, ageism, the consequence is that older people kind of have a sense of futility around the issues that they're experiencing as sexual beings. I see sexual dysfunction, I see low desire issues, I see relationships that have issues of desire, but it's young people who are coming to therapy because for them it is something that they shouldn't be experiencing, and so they come to fix it. But if you're an older person, it's something that you should be experiencing, and therefore there's no fix. And so that's an example of how ageism and internalized ageism shows up in the ways in which we don't address these issues, even though what are the facts, right? Kinsey studies throughout the last 60, 70 years have shown that men over the age of 60 and 70 are sexual. 92 to 98% of men in that age range are sexual. About 50% of all men in that sex age range have sex at least once a week to once a month. In the 1940s, when Kinsey first looked at studies, the level 70% of women over the age of 60 were sexual, and now in this, it's all the way up to where men are, which is in the 90s percentile. So a lot has happened in the sexual evolution, right, of us as baby boomers that has allowed that. So what we really understand is that the facts don't really represent the assumptions and the myths. What are some other myths about older adults? One is that older adults are no longer interested in sex and sexuality, and that they no longer engage. Obviously, we have facts that disprove that. Another one is that changes in hormonal levels which occur during and after menopause create a deficiency disease, right? That cause women to find sex uncomfortable and unpleasant. Certainly there are aging issues and health issues that impact older adults, but all of these issues can be addressed, as you know, through we have treatments. We have hormonal treatments. We have topical treatments. In other words, these are issues that just as young people can, I have young people who have low testosterone or low desire and would benefit from treatment just as older adults would, but older adults don't go to get that treatment and therefore don't engage in potentiating their lives, their sexual lives. Another myth is that women are, because they're beyond their childbearing years, lose their desire and their desirability. Well, it turns out that the research shows the opposite, that actually partners find their partners more attractive as they age, not less attractive. So the realities don't match the myths, but that's what we come to believe. There's another one that says that you have to have one partner to have a fulfilled sexual life. Well, a lot of older adults lose partners through death or widowhood or divorce, and so that, are we then limited because we don't have a partner? In fact, not having a partner is one of the major issues, especially for women, around being sexual in older years. Another one is that of course, that the only satisfying sex is intercourse, and so that totally dismisses all the diversity of sexual expression and all the diversity of sexual communities. And also that older adults are not at risk of contracting STDs, which Joyce will talk about, because we don't have sex, we don't get sexually transmitted infections. So, so let's look, continue to look at that. And please tell me when I'm done.
We'll give you 2 more minutes.
Okay, so the media, how does the media portray us? How are older adults portrayed as, in movies and magazines? What is it,
As the fool. I hate that so much.
As the what?
As the fool. They're like this caricature.
Caricatures.
Yeah.
And are they sexual?
No.
No, in fact.
They're on a lot of medication.
In the Viagra commercial.
Yeah.
That's true.
No, so that turns me up that I see that all these couples, first of all, they're mostly couples, which is insulting lifelong singles. That's another issue. But it's hard when you're single and you're looking, when the ads are the blue pill, which I'm sorry, I have an issue. I'm a nurse and I have an issue with that because I think differently. Younger women, men still are doing, and and the red hat ladies, they've kind of said, he's home, he's dead, dying, he's in the chair, and I'm going out with the girls. And it's just, for me, it's like, what the heck's going on?
That's
and I'm
right.
a boomer, man. I survived the 70s and 80s,
Right, and so we agree, you and I, about that, for example, things, medications like Viagra phosphodiesterase inhibitors, address biological experiences, but they don't address the psychological and emotional issues. Viagra only works if you're turned on, but if you've got marital conflict and if you've already internalized all of the issues that you shouldn't be sexual or that you're not desirable, what is that going to do to your biological response, to your arousal? So as a therapist, it's not just about the blue pill, it's really about how do we treat the psychological and emotional impact of all of these issues of ageism, of internalized ageism, sexism, right? We have a differential view in which we treat older women relative to older men, right? If you're an older man, you can be with a younger woman, but what do we call an older woman who is interested in younger men? Right, is that a positive? Are cougars seen as something positive, right? As we see men as aging distinctively, but we see women as, not, right? So we have the old double standards, right? Certainly being, again, imposed on the aging community. So that's the confluence of ageism and sexism. Certainly all of these issues manifest in managed care. Is the sexuality of aging adults really a matter of importance or priority when older mature adults go into assisted living or
mental health.
Are their relationships addressed? Is their mental health issue addressed around depression? Because depression, mental health issues are certainly barriers to healthy sexuality. All of these issues are, really important for us to understand how to potentiate our sexuality and sexual lives throughout the lifespan. And so, in there, happy Pride, everybody. If you have any questions, let me know.
Yeah, we'll save those for the end and we'll continue with Dr. Lisbon.
Okay, hi. Well, thank you for having me here. I have had many years in this field, and because I believe that sex and relationships and intimacy is so very, very personal and complicated, as you indicated with all of the social input and personal input, I usually provide information and tools and use methods so that we can ask ourselves better questions and move forward. And I think we've started that with your presentation. Today I thought, because I wasn't sure what was going to happen today, I thought I'd focus on two very practical and pragmatic issues that affect us as we age. And that one that has already been mentioned is STDs. And the other is safety in dating. And I would like to address that with a little bit of information, and then hopefully afterwards we can all talk more about these things. In general, most of us, as we're aging, I know I just had a big birthday and I feel pretty healthy and engaged, and I'm very proactive, and I think many of all of us who are aging are very proactive in maintaining our health, looking at our diets, looking at exercise, and we work at staying healthy. Our generation is healthier than previous generations. Many of us are still traveling, reaching out for new activities, and our lifestyles are very rich. With that has come an increased extension of sexual energy and sexual lives. Because many of us have been in long-term monogamous relationships, we have not been paying attention to the fact that STDs are very prevalent, and they are very prevalent among our age group, which I think a lot of people are surprised about, and those numbers are growing. Some of the reasons for that have been addressed already. One of them is the fact that we have Viagra, Cialis, all of these drugs that are increasing the male activity, and there's been research that shows that men who do use these blue pills, or whatever color they are very cavalier, for lack of a better term, about not using condoms. And the percentage of those who do not use condoms is significant. So that's one consideration. The other consideration is women are enjoying sex and associating sex with pleasure a lot more as they age because of all the lubricants and hormonal treatments that are now available. So sex is pleasure and not painful, which I think many of women in previous generations have experienced dryness and thinness of their vaginal walls, which has made sex very uncomfortable. But we're fortunate we can take action and still enjoy sex. Hopefully, and I say still because I'm hoping that our generation has really turned those statistics around, and many, many women do enjoy sex just for having sex, not being connected with reproduction. Okay, and that's a big issue, and I think our generation transitioned that, allowing us to think of sex as fun, something pleasurable, and not necessarily, thanks to the pill, always worried about pregnancy and unplanned pregnancy. I just want to share with you, and this is hard, I didn't do a PowerPoint, but STDs are really a problem for our age group. There, in 2013, an estimated 8,575 new HIV diagnoses were among people who were 50 and over. So that's a lot, and it's something to really perk your ears up if this is a statistic that might be new to you and a concern that might be new. persons aged 55 and older accounted for 26% of the people who already had HIV and had that diagnosis. So that's something we don't usually think about. And so many of our, not many, but some of our friends might already have this disease. And because of wonderful medications and treatment, they might not be sharing that information with us, okay? Older Americans are more likely than younger Americans to be diagnosed with HIV and other STDs later in the progress of the disease because, as was mentioned, we are not engaging in dialogue with our physicians about our sexual behavior. And we find it sometimes shameful or embarrassing or just awkward. And the doctors also have not been asking us the appropriate questions to find out if we are sexually active. There is this sort of gray, murky cloud that, oh, I don't want to bring it up. And by the numbers or lack of numbers of people who are here today, this is still an incredibly embarrassing and toxic subject for people, unfortunately. And for people of all ages, but particularly for those who are older, okay? So I think we need to look at the medical issues related to this and to have the confidence to engage in dialogue with physicians as well as with our friends. Because once you break that little ice, as soon as I say I'm a sex educator, I'm asked quite a few questions and people share a lot of information with me. Fortunately, I don't remember all the details, and so I can just respond and move on. But it's amazing what's going on and what isn't talked about. The other, in addition to the HIV/AIDS issue, which is significant, I think we need, when I was younger, I think everybody just worried about crabs. You know, I mean, and now life is much more complicated. And even chlamydia, which is mostly associated with people from 18 to 24, has increased significantly among older people. And chlamydia is can be easily cured and treated. It is not a virus, okay? So it's important to, if you are sexually intimate, sexually active, to share that with your physician and make sure that you're getting tested and screening. And just to, another pragmatic thing is that Medicaid does now cover STD screening for all of us. So you don't have to worry about costs, which is always a significant issue for people. So why are these numbers growing? Well, we're living longer and better. The group living issue, or assisted living, or living in almost, if you can think back, if those of you have ever lived in dorm situations, a potential partner is now just down the hall, okay? And believe me, there's a lot of traffic going on, because I have done some talks in some of these sort of living situations, and people are busy, okay? And not only are people busy, the men do have an advantage because there are more more women than men. And women have learned to accommodate the situation and are not expecting monogamy the way they might have, 20, 30 years ago. So there is sharing going on. And that increased sharing, especially if a condom is not being used, increases one's risk. So even if you're having sex with more than one partner, or your partner is having sex with more than one partner, your risk increases. And this is the kind of thing that is sort of not talked about very much, but that's why I'm here, so we can talk about it. And the other thing is sobriety. We think of younger people getting smashed and not being in control and, wanting to use condoms appropriately. But this does happen with people our age as well. We might not be getting smashed or but even if we have one or two drinks, our behavior changes and we are at risk, especially if we're also taking other medications. And so there's, an increased risk that we really need to be aware of. So as we age, our immune systems are not quite as strong as they used to be, so we're more receptive to welcoming these little bugs in our body, and we have to be aware, okay? Women do experience a thinning of their membranes in the vagina, and that does make us more receptive to some of these bacteria and viruses. So we have to be particularly careful. And so there's a lot of reason not to, to use condoms and not to just worry about pregnancy, which most of us don't have to care about. So those are STD risks that I would just like to sort of let you sort of put a little red flag up. But the other issue that I wanted to briefly talk about is the business of knowing what you want. And that I think is very difficult because we have grown up, and this is a generalization, of playing a lot of games about sex. And I think that's still present in the younger generation, where women are supposed to be the gatekeepers and no, and the men are supposed to be aggressive. Well, there's been a lot of acknowledgement that those kinds of games have really created a great deal of problems when we communicate, when we are on our date or hanging out, whatever. I mean, dating for younger people is like considered a passé tradition. I think people in my age group still use this term. But when we are in that one-to-one situation, we really need to make it clear what our intentions are or our expectations are. We don't have to state it bluntly, perhaps, especially on the first 1 to 2, and then 3 is that magic number where there's supposed to be this huge transition in our physical intimacy. And that goes back to Seinfeld days. But I think it's really important that we know what limits we want to engage in. And we have to decide whether we're interested in casual sex or just affection, or if we just want companionship and someone to travel with, or if we want another spouse, or an intimate one-on-one relationship. So the range is quite broad. And as we age, our desires and our needs are very different than they were when we were 25 or 35. And so we have to be honest with ourselves and be able to state clearly what we want. There are lots of terms now, like establishing consent, which is something that is relatively new. I know when I was working on my doctorate, this was my topic of concern, and prevention of date rape. Date rape was not even a term when I was growing up. It's a relatively new term. So men and women need to be more cued into the communications that they're giving off and that they're seeing. We have to be more aware of body language, and we have to be more aware of what we want. And once we're clear in our minds, not that we can always change our mind and our situations change, and maybe date 1, hands off, date 5, let's go for it. Who knows? I mean, we need to be flexible but clear, and if we're confused, there's nothing wrong with sharing confusion. And that's true for men and women. And I think the idea, I think a lot of what I'm saying might be seen as messages primarily for women. But in all honesty, men, I think, are very, very cautious about being physically intimate as well. We are at an age where there's a lot of vulnerability for both sexes. We know that our bodies look different, feel different. We're a little slower maybe in the uptake. We're very, very aware that we might not be as sensual or as stimulating as we were 20 years ago. But that doesn't mean that we're not interested in exchanging physical embraces and intimacy and engaging in pleasure and affection. So all of these issues, I usually engage in conversation more, and I hope that if nothing else, you'll ask more questions. But those are the two main, very practical issues that I think are important for people our age to be aware of. That when you are engaging in new relationships, there are risks. There are health risks, including the STDs, and there are also a lot of emotional risks. We have to realize that we're going to be communicating with people in a very, very different way, especially if I've done some, I was mentioning I've spoken to widow and widowers groups. And that's a very common situation for people. And to re-engage after many years with one partner, it's quite a challenge. And I think we need to help people address those challenges honestly and give them an opportunity to reflect on the conflicts that they might have. Okay.
Thank you. Adi, you want to continue?
Well, what's left to say?
That's hard.
It's very good information. Anyway, how did I get involved in this business of sexuality in seniors? Being a physician, as a general practitioner, actually I saw quite a bit of couples coming in worried and concerned about their sexuality. Then when I went into emergency medicine, a lot of that fell by the wayside. But anyway, I started writing 35 years ago, basically as an avocation. And it was a good way just to kind of relax at the end of a busy day. And I had two niches that I wrote in, and I still write in. One is historical novels, but the big one is self-help books aimed mainly at seniors and baby boomers. Why? Because I've been there, and I know what's going to worry all you people when you get to be my age, which is probably a lot higher than any age in this room. But about 20 years ago, I was commissioned by a publisher to write the first book on Viagra aimed for the general public. And a condition of the contract was that I had to have the manuscript into them by the day, or in so they could have the book on the market the day Viagra hit the market. And I didn't think much about that. It was a new product. But what I didn't really think about, I knew it, but I didn't think about it, it was a totally new type of product. To that date, there really hadn't been a medication aimed at erectile dysfunction. And as I was writing the book, I saw, well, there's a few people that are interested in this topic. But I just fulfilled the contract. Well, to my surprise, in the first 3 months that book was out, it sold 60,000 copies and was translated into 4 languages. And that gave me an idea that, there's some interest out there in this topic. So a few years later, the book still kept selling. And of course then came Cialis and Levitra and all kinds of potions and rub-ons and drinks and this that are supposed to do the same thing. And I started noticing that all the ads on television, Levitra, Viagra, Cialis, and they just ran and ran and ran, still are running. So about 4 years ago, my publisher said, why don't we do a book aimed at senior sexuality? And so I wrote Sex in the Golden Years, which got some attention, but the subtitle, I think, is what really started selling the book, The Best Sex Ever. And, people over the age of 45, most of them kind of thought, well, I'm a bit over the hill now. And they didn't realize that the best is still ahead. And I really mean that. What we discovered in the research is that all it really takes, and I could look back at my own experiences because, you know, by that time I was well into my 70s. And we realized that, you know, the big difference, if you have a little bit of an attitude and goal change, sex really is a hell of a lot better in the golden years. It is a total mindset that changes with time. You take your time for one thing, because physically you got to slow down, but that has a lot of benefits, especially to the woman partner. There's no more of this wham bam thank you ma'am stuff, because the old man's lagging behind a little bit. But it does make a difference. And you tend to spend more time with foreplay, which brought about the next book, Foreplay, the Real Focus of Great Sex. And that book took off. And, you know, it's an interesting thing. What happens with age, actually, as far as women are concerned, there's a lot of statistics say that women get far more orgasmic as they age. And I really believe that. If the partner really takes time and pleasure the other partner, it makes all the difference in the world. And with age, this happens. It almost happens kind of naturally. And if people realize this, then really the pleasure becomes much, much better, much more intimate. And I think this is what people have to really, really focus on as they age, the intimacy part of it. And even in cases where one partner perhaps loses some of the desire, that partner can usually get a great deal of pleasure in just pleasuring the other partner. But you don't have to have an orgasm each time to enjoy sex. But that doesn't mean that you shouldn't try to have an orgasm, which brought on the third book, which is the Big O, Male and Female Multiple Orgasm. And this really, it's interesting, and all these books are bought mostly by women. Men are too stupid to buy these books, but women buy them for their partners. And the best way to read these books are as partners, to read them together. Because the one big thing that does, as therapy does, it gets people to talk about the things that are bothering them that they wouldn't put on the table otherwise. And I think that with just some simple changes of thought and attitude, sex in later years, and I'm 82 years old, in later years can really be a hell of a lot of fun. And there's actually a fourth book that I've never considered as a sex book, but I wrote a book when I lost my first wife after 48 years of marriage. I wrote a book, When Your Spouse Dies. And there's a couple of chapters in there that deal especially with dating after you've lost a spouse, in finding new partners, etc., about STDs, which there are some statistics that show that the fastest growing age group to have STDs is the seniors, 50 and above. So it's something not to be taken lightly. And I'll turn the rest of it over to questions for everyone.
Have you seen or heard of a push for medical providers to be more encouraging of their patients and clients to talk more about sex? Because I know that you mentioned that sometimes as a patient, maybe an older adult is embarrassed or doesn't want to talk about sex, but has there been maybe a push on the side of the medical profession to also encourage them to encourage their patients to talk more about sex so that it can maybe be a two-way street?
I think one thing that can open doors, and it is almost mandated, I don't know if it's mandated in Colorado, but many docs now ask people if they're in a safe relationship. And that can open doors for people. And I know I moved here from California and that was mandatory intake. And I know that when I go to a physician, that is usually on the intake form. And I think that's a very opening the door a little bit. Other than that, I think that there are many, particularly the younger doctors, who I think engage their patients if they find wiggle room to discuss this. But I personally encourage the patients to open that door because it's our health. And, you know, I don't think we really need to hold back in terms of asking doctors. But I don't know of a particular movement in the profession itself other than the safety issues. And I know that that's been pushed for the last 10 years across the board.
Well, certainly I believe that that would be best practices, you know, because as we said, you know, our sexual lives don't end. But I don't know whether those communities actually engage in those best practices. I know that as a sex therapist, my clients report to me that they don't get asked those questions where they go, and even to therapists who are not focused on this. And I know personally, as a client of medical, you know, professionals, I have not been asked those questions about my sexual life. So I think it's a hurdle to, you know, that there's a lot of shame and embarrassment about talking about sex across the culture. This is a sex-negative culture at its core. And so we have to, you know, how do we educate and teach to overcome those barriers?
As far as medical school, when I went through, it was never touched on. I don't know what medical school is like today. It may be a totally different story. But, you know, I grew up in a period when sex just wasn't talked about much. When I was a teenager, when I was in my 20s, it was a different world in those days. It really was. And I've been out of medicine now for about 6 or 8 years. It changes every year, so I can't keep track of it. Anyway, I've been out of the loop, and I really don't know what is going on that much in family medicine or any of those areas. I know that in the emergency room, we got a lot of people who came in and they were complaining about medications they were taking, and that led into the fact that since they were taking these medications, their libido dropped off dramatically. And this is one of the big problems, especially for men. A lot of your blood pressure medications, a lot of your sleep medications, a lot of pain medications, just really knock it down. And if this is going on, you know, you should talk to your doctor and see if your medications can't be changed or altered. Because there's a lot of ways to go. For example, and this includes women, the SSRIs that are given for depression can really make a big difference sexually. And there's an over-the-counter medication called 5-HTP, 5-hydroxytryptophan, which does almost the very same thing that the SSRIs do. And it has none of those side effects. So there are ways of juggling. Now, I'm not telling you to stop taking your SSRI. I don't want to get between you and your doctor. But I'm saying ask your doctor about that. And medication is one of the real big problems. With women, it can cause dryness, and with men, it can just cause erectile dysfunction and drop in libido.
I just wanted to add something anecdotal. I used to be the health educator at the University of New Mexico. That was one of my jobs for about 12 years. And I instituted a peer ed program that became very popular with the pre-med students. And it turns out that when you think of who goes into medicine, they're not the guys and women who are partying and, you know, fooling around. They're pretty much the straight shooters, and I'm telling you that the peer educators who were pre-med students were so serious and lovely students, but incredibly naive and not very, very on top of what's going on sexually, and I mean that emotionally as well as the actual physical experience. So I think that is still, I'm assuming, hasn't changed that much in the last 15 years or 20 years, and that the very, very serious student is still the one who's going into medical school. You can't be out partying until 3 o'clock in the morning if you have exams. And they're not comfortable with these issues. And that's why I have felt more comfortable in encouraging the patient to initiate this, because it hasn't changed that much in medical school either, from what I know.
I would like to add too that if you think there's a threshold, you know, around talking about sex in the medical profession, imagine that threshold around talking about sexual orientation, bringing up, you know, same-sex sex, sexuality, sexual diversity. My guess is it's even worse. A long time ago, as a result of, I remember way back Prop 2, you know, we had an organization called the Speakers Project to End Discrimination, and we were actually asked by medical classes to come in and talk to medical students about sexual orientation so that they would be brought up to date on some of the issues.
I'd just like to add that everything that's been said here today really fits in with whatever orientation you have. The same thing goes for gays, lesbians, bisexuals, transsexuals. We all react the same way as far as sexuality is concerned. You know, the partner's different, that's the only difference.
Well, I would say that, right, the way the sexual expression happens, yes, but the cultural response is very different.
Very different, right.
Thanks for watching our tough talk on sex after 60. I hope you were educated a bit and entertained a lot. I also invite you to take a look at our website, alittlehelp.org, to learn more about A Little Help and the great services we provide our neighbors and our elders. And you can learn more about our partners on our website as well. Thanks very much.